How does fasting for cholesterol tests impact your metabolic state? Imagine your body as a busy city, constantly processing food, energy, and waste. When you eat, your body digests fats, sugars, and proteins, which temporarily change your blood's composition. Cholesterol, a type of fat or lipid, circulates in your blood and is vital for building cells and making hormones. But too much of certain types of cholesterol can increase your risk of heart disease. That's why measuring cholesterol levels is so important. When you have a cholesterol test, your doctor wants to see your typical blood levels, not just what they are right after a meal. That's why fasting has been a standard practice. Fasting means not eating or drinking anything except water for about 8 to 12 hours before the test. This helps clear your blood of recent food effects, giving a more stable picture of your baseline cholesterol levels. Now, when you fast, your body shifts into a state called post-absorptive. This means your digestion is complete, and your body relies on stored energy, like fat and glycogen, for fuel. During this time, blood levels of triglycerides, another fat in your blood, tend to be lower and more consistent. This is especially important for people with conditions like diabetes or high triglycerides, where recent meals can cause big spikes in triglyceride levels. For total cholesterol and high-density lipoprotein, or good cholesterol, fasting has less impact. Research shows that fasting does not significantly change these levels for most people. The difference between fasting and non-fasting tests for these measures is usually small and unlikely to affect your treatment plan. However, for low-density lipoprotein, or bad cholesterol, fasting also makes little difference in most cases. But triglycerides are a different story. After eating, triglyceride levels can rise sharply, especially in people with metabolic issues. So if your triglycerides have been high before, fasting helps get an accurate reading of your true baseline. Fasting before a cholesterol test can help standardize results, making it easier for your doctor to compare results over time. If you are being monitored for hyperlipidemia or high blood lipids, fasting can help assess how well your treatments are working. It also helps in making decisions about medications like statins. In recent years, the need to fast before cholesterol tests has become less strict for some measures. Many healthcare providers now accept non-fasting tests for total cholesterol and good cholesterol, making testing more convenient. But if your triglycerides are a concern, fasting still provides the clearest picture. So in summary, fasting mainly affects triglyceride levels, which can rise after meals. For most other cholesterol measures, fasting has minimal impact. If you have high triglycerides or other risk factors, fasting remains an important step for accurate assessment. Always follow your healthcare provider's instructions, as they will recommend fasting or not based on your specific health situation.